It's a great honor to be here. I have a few things I'd like to say about where I think we are, but first I want to take a pause because none of us would be in this room without Beth Rom-Rymer. Thank you very much for your years of perseverance and dedication. It is a long, arduous, rocky, and very expensive road to change the scope of practice of a profession. Beth knows that better than anybody, and she provided a great map for other states to follow. And it's interesting that many of the challenges are expected, and as earlier speakers said, those challenges can be, at least in large part, overcome by respecting the concerns and desires of other professions and recognizing that they're in this in an attempt to make patients better and to do good. Sometimes the hardest lessons come from within, when we have folks within our own profession who are so vehemently negative and antagonistic indeed towards folks who want to expand our scope of practice. And so I really thank you for suffering those errors which are probably, those are the ones that hurt the most. So thank you again for doing that. It is a long road. In 1991, I began in the DoD training program, and it was not until 1994 that I was allowed to independently write my first prescription for a patient. It was not until a decade after that the first state passed enabling legislation to allow psychologists to prescribe. And it was not until nigh on 15 years after that that Illinois successfully did what they did. And so it's not over. We have 5 states. We need a whole lot more. So I encourage you to accept that it is still going to be a long, hard, arduous, expensive road. But it's made a little bit more easy to travel by the things that Beth and many of you in this room have done. So thank you all.